Dispensary of Hope is primarily focused in Washington County, and the Washington County demographics, we have about 125,000 people here. It's actually in the center of an economically challenged and very rural area.
They are working in the strawberry fields. They're in the fields doing manual labor, and just imagine trying to manage diabetes in 95-degree heat.
One-third of my time with the patient, any patient, one-third of my time is spent on figuring out how am I going to get your medications for you? How am I going to assist you in that? There's not a provider here that doesn't pretty much have that $4 list memorized. Yeah. And so we all, we're writing those $4 drugs left and right.
In this population, okay, they may only get one meal at the day center or at Good Samaritan or at Salvation Army. They only have starchy things there.
Again, compliance is an issue. It's hard to tell someone they need to come and get their metformin every month or they need to come and get their lisinopril every month if they don't have anywhere to stay or they're not eating that day. So that's a difficult issue.
So we may see them, in 3 months, but they may be lost to follow-up for 6 months to a year.
And the biggest challenge that we have for the dispensary is ongoing funding and is making the case and being able to prove it that by us doing what we're doing here, that we're keeping people out of the emergency department, we're keeping people from going to the hospital, and that's a hard challenge. And I'm not a physician, a nurse, or anything else, but I know that it's bad when someone has an A1C of 15 or 12, and we've taken people like that and gotten their A1Cs down to this 8, 7. We've had people that have come in and say, this has changed my life. I feel better now. I don't have to take as much insulin anymore.
The College of Pharmacy likes us, and we love them. This is a huge opportunity for their pharmacy students to come down and interact with our patients. They do medication reconciliation, and they look at what the patient has brought in, or they'll look over the medication list that's in the chart, and they'll talk with the patient. That patient got one-on-one instruction, quality instruction. There was no doubt in my mind that she left here far better educated than I could have done, because I would have been pushed for time.
As pharmacists, we have access better than anyone else in the communities. I don't care if you're in Johnson City, I don't care if you're in San Francisco. We have access, period. Getting to know the patient, getting to know, building rapport with them, and I know we do a great job as pharmacists, we do that. But we can impact, no matter how small your pharmacy may be, no matter how large your pharmacy may be, we can impact patient lives. We can impact diabetes care, that's what we're talking about. And we can impact whether they take their medicine, whether they check their blood glucose, or just they need somebody to talk to about what they should eat. It's phenomenal for a pharmacist to be a part of the team that goes to the camps and even for the homeless as well, for any of these patients. It's vital for pharmacists to be a part of this moving forward.